Well, non-profit organisation Ritshidze is today launching a report on public health care in Mpumalanga. The annual report details the challenges and positives of public clinics in the province. And to talk more about this, I'm now joined by Ndivhuwo Rambau, project coordinator at Ritshidze. Ndivhuwo, thank you so much for your time and good morning to you. Quite an important report, I have to say. Oftentimes the spotlight can be on, major hospitals, it could be on, other healthcare facilities, but our clinics play quite a crucial roles in community healthcare access. What is to be expected in this report?
Okay, so this is our third edition of the Mpumalanga State of Health Report. This year, as Ritshidze, we have switched things up in terms of the community meetings. We are doing district community meetings where we've invited district managers to come and hear the challenges that Ritshidze is finding in some of the clinics that we are monitoring. Today we are in Kabokweni, which is focusing on the eNCA district, where we monitor about 21 clinics within the district.
So when we pin down, the nitty-gritty details of the report, what exactly do you look at in terms of, the bridge that the clinics obviously, or rather the gaps that the clinics bridge between healthcare as well as community members?
So as people living with HIV, there are quite a number of reasons why people end up disengaging from care. And the main reasons are often the root problems that we find within facilities. So, for example, when we look at the Mpumalanga State of Health report, only 35% of facilities reported that there are enough clinical or non-clinical staff. And this has worsened from last year, where about 41% had reported having enough staff. So we know that staff shortages obviously lead to longer waiting times. We have testimonies of people living with HIV, of patients saying that, look, I got to the facility and I got there at about 12 p.m. They didn't see me. They told me to come back the next day. You don't have money for transport all the time. You are probably working and you have not disclosed that you are living with HIV. And now you have to ask your boss if you can go to the clinic again. And your boss is like, but why are you going back? So it's these kind of issues that people end up disengaging from care. We've also found that positively the waiting times have reduced by nearly an hour in the last year, monitored in Mpumalanga, down to an average of 3 hours and 12 minutes, which is a very good improvement. And we really commend the Department of Health on that.
Yeah, and I have to say it is, a good improvement. When we talk about waiting times, I mean, we know that as early as, 5 a.m., 3 a.m. sometimes, we would previously hear reports, people waking up in those hours just to make it to the queue and to get their medication. So, cutting down on waiting time hours is quite a big deal. But also, I mean, when you spoke about access to, let's say, ARVs or other medication, for example, what could be also of, particular problem here in Ndivhuwo? Is this access to funding the problem? Are we seeing that resources in most of these clinics also play that role?
So I think the first thing we need to talk about when it comes to ARV collections is the strategies that are being used. So if we have people living with HIV receiving maybe a 3 to 6 month supply, for example, of the ARVs, we are basically decongesting the facilities because you don't have people coming in every single month to come and just collect medication. So if a person who's living on HIV is stable on their treatment, they should be getting a 3 to 6 months refill. Moreover, as Ritshidze, one of our key recommendations is that we decant stable people living with HIV out of the facilities, and we ensure that we have more community pickup points where people go, they pick up their treatment and they leave. And if you are going to go to the facility, it's either because you're sick or you're going for your annual viral load test, for example. So it's very important for us to start decanting stable people out of the facility so that we can decongest them. We can ensure that, if you are going because you've got flu or whatever the case is, you don't wait in the very long lines compared to going to receive one bottle of your ARVs.
Yeah, absolutely. And another report will be focusing on public health care in Mpumalanga, but in terms of other provinces and, access to such reports and how, clinics and healthcare, access is doing in other communities. Do you make mention? Do you account for other, provinces besides Mpumalanga?
So Ritshidze has a footprint across 8 of the provinces in South Africa, apart from the Northern Cape. The next community meeting is going to the Northwest, where we will be unpacking and launching the Northwest State of Health report. So we do give daily updates to the Department of Health as well to say this is what is going on. If there are key advocacy points, the PL-HIV sector organizations, namely the Treatment Action Campaign, Positive Women's Network, Positive Action Campaign, Sandarela Plus, as well as NAPWA, will go into those issues and advocate for either people living with HIV and even key populations, so that these issues are not just swept under the carpet, but people are actually helped in real time.
And, I can appreciate the report, Ndivhuwo, because this is data-based, right? This is extensive research that goes into the work that you do informing, on those recommendations. But just in closing, I suppose moving forward, your recommendations when it comes to, access to healthcare and the role that clinics play, just in making sure that they're functional. You've mentioned staff shortages also being quite a negative. You've mentioned the cut in queues being a positive. But in terms of your closing remarks on interventions moving forward to make sure that our clinics are functional, what would that intervention be?
So we have a number of recommendations based on the different issues that we have highlighted in the reports as well as the district reports. And these recommendations are not just directed to the Department of Health or the Mpumalanga Department of Health, but also to district support partners who work within this province. So, for example, we have recommendations specifically for right to care, and we also have recommendations for broad reach, and as well as PEPFAR as people who are funding the HIV response in the country. So with the recommendations, we will, for example, when it comes to staffing, we would like to see the department producing an annual report on the number of healthcare workers per cadre employed in each district. And we've also asked that they fill all vacancies in 2023-2024 financial year to ensure that our staff within facilities are not burnt out, because in most instances, when healthcare professionals need to see more patients than they have to, they end up being burnt out. They end up being frustrated, and that's what leads to the unpleasant attitudes that some patients then end up facing.
Yeah, well, I appreciate you, of course, speaking to me about this important issue and also the work you're doing as Ritshidze and this report that I would advise, everyone, even if you're not in the health sector, you're just a community member, a South African citizen, make sure you get this copy if you can and read it for your knowledge base. And Ndivhuwo Rambau, Ritshidze project coordinator, thank you so much for speaking to me right here on Newslink on eNCA.